It's time for Baby and Toddler Instructions with host Blythe Lippman. Blythe is a nationally renowned infant and toddler expert who has over 30 years' experience helping moms and dads regain their sanity, teaching them how to survive, and giving them the confidence they need to be the best parents ever. From sleeping to crying to potty training to choosing a preschool and so much more. If you're a parent, Baby and Toddler Instructions is the show you've been looking for. Now here's your host, Blythe Lippman.
Well, good morning, afternoon, evening, wherever in the world you might be. Thanks so much for tuning in to Baby and Toddler Instructions today. It is Wednesday, and it is already January 11th. Wow, it goes so quick, I can't believe it. I hope all of you are getting back into the swing of things, getting your little ones to preschool. Sometimes it's so tough because they've been off for a couple weeks. Maybe you've had vacation. I just want to give you a quick tip. If you have a little one that goes to preschool and you have to get them ready out the door so you can get them there and you can go to work, get yourself ready first. Get up an hour earlier, have a cup of coffee, meditate, walk around the house, whatever gets your day ready, but get yourself ready first, because when those little ones get up, you think it's going to take 20 minutes, a half hour, and who knows what happens. They spill something. They have a dirty diaper. They don't want to eat their breakfast. So enjoy that time before you wake your little ones up. It's quiet in the house. Anyway, quick tip. So let me tell you about my show today. I am so excited. I have the greatest guest, Alice Domar. She's a PhD, and she's the author of Finding Calm for the Expectant Mom, Tools for Reducing Stress, Anxiety, and Mood Swings During Pregnancy. And she's going to be with us in just a little bit. I do have a couple things to share. First, there were a couple of recalls. One was the Active Kids KYDS children's toy shovels and garden tool sets due to lead violations. They recalled those. And second one was Walt Disney Parks recalled the Minnie and Mickey Mouse the infant hoodies because of the choking hazards. The snaps on the hoodies can detach, posing a choking hazard. So if you have either one of those products, don't use them. Go to my website, mybestparentingadvice.com. Go to Recalls 2017. You'll see on my website, and there are all the contact numbers are there and the emails. And I know these two in particular will give you refunds. They're not going to try to fix it. Some of the things that are recalled, they do try to fix. But don't ever try to fix anything yourself if it's recalled. I mean, you know what? It's just not safe. And accidents happen, and things go in the mouth, like this sweatshirt, little hoodie. Anyway, just 2 recalls this week. There were a couple other ones last week that are already on my website, and all the recalls from last 4 years. So before I go on, I want to send prayers to the families that were part of that terrible, terrible tragedy at the Fort Lauderdale airport. I mean, it's so senseless. It just breaks my heart. And one of the men that was killed was a really good childhood friend. And my prayers to his family, to his friends. I mean, you know what? We have to enjoy each day. Take a few minutes. Even if you're really stressed and have a million things to do, take that time to sit on the floor with your little one. Make lots of memories. Life is so precious. So sending lots of prayers and healing energy to everybody that was involved in that terrible, terrible tragedy. So going on, let's see. I don't want to scare anyone, but do you have any idea how much it costs to raise a child? Don't get scared if you're pregnant, thinking about getting pregnant. It's always great to be prepared. But there was an article that says it costs $233,610 to raise a child. It could cost you nearly $250,000. A middle-income married couple with 2 children is estimated to spend this amount of money. And this was released by the Department of Agriculture Monday, and that number covers the cost from birth through age 17 and doesn't include college expenses. Family can expect to spend between over $12,000 and nearly $14,000 a year to raise a child. Housing was the biggest expense because they may need an extra bedroom. Food was the second biggest budget eater, and another huge expense was child care. It says cost parents an average of $37,378 a year to put your child in daycare, according to the government. Besides the diapers and the food and the toys and the transportation and the health care. You know what? Unbelievable. But I have to say, it's worth every single penny. There is nothing like having children. So if you're thinking about having a child, or if you have children, even if you put away $5 a week, $10 a month, keep that budget going, and it will be a little easier for you. So I thought I would share that because, boy, it blew me away. That's a lot of money to raise a child. But again, so well worth it. Okay, also, let's see. What else do we have here? Well, if you're new to the show, I've written 3 books. Help My Baby Came Without Instructions, More Help My Baby Came Without Instructions, and Help My Toddler Came Without Instructions. And when you're a parent, you have many, many decisions to make. Everything from should you swaddle your baby to when is your toddler ready for potty training. That's why I wrote my books. I wrote them to make it easier. My tips are short and sweet in list form to make your hectic, sleepless lives easier. And you can purchase them from Amazon, BarnesandNoble.com. If you don't like to read, they're on Audible.com. You can put them on your devices and listen. And you know what? You just pick the chapters. I made my chapters easy. Again, I made it list form. I have chapters breaking up with your binky. It's my potty, and I'll try if I want to. So today, I want to share a couple tips from Help My Toddler Came Without Instructions from a chapter called Ouch, That Hurts. I want to give you a couple of tips about biters. Sometimes kids bite, and depending on their age, they don't know what they're doing, but depending on their age, they bite for different reasons. They might be teething, they're hungry, they're frustrated. If they can't use their words and they're playing with a toy and another toddler takes it, they just bite. It's not like they sit there and they think, well, I think I'll bite my friend. Anyway, so if you have a biter, especially if they're in preschool, ask the teacher if they bite the same time every day. I know this sounds silly, but it may be snack time. So first determine when they bite, and if there's no rhyme or reason, you know what? They're just a biter. So when your child bites, do not try to have an intelligent conversation with them and tell them why they shouldn't bite after they've bitten, because usually somebody's crying. But there are some great books about biting that you can read another time when it's calm and, excuse me. So don't try to talk to your toddler when they're biting. You know what? It's just not going to happen. If your toddler bites a friend, before you can even jump in, you know what? Take your arm, hold the other toddler, put your arm around the other toddler, and you can say, teeth are not for biting. Your friend is crying, but no more words, because you know what? Usually when you talk, your toddler hears the first 3 words anyway. Also, if your toddler bites every day, maybe they're getting a tooth. Give them things that they can bite, pieces of apple, pear, carrots, but never, ever leave your child unattended if you're giving them something to bite. Also, if you realize that your toddler is a biter because they're frustrated, maybe they need to go outside and run around, a game of catch, or maybe they need a beanbag, or maybe they need to take a ball and bounce it, or just, do something active. Toddlers are very active, and they don't sit still. Their attention span is very short. And sometimes they're just frustrated. Their vocabulary may be very small, so they can't say why they're biting, what's bugging them, if they're tired, if they're hungry. So anyway, those are just a few tips from my chapter in my book, Help My Toddler Came Without Instructions. If you have any other questions, you can always contact me via my website, mybestparentingadvice.com, or you can call my office at 480-510-1453. I do in-home consults if you live in Arizona. I do video consults, and I do telephone consults as long as everything is non-medical that could help you those first 4 years. So those are things I wanted to share before I welcome my guest. We're going to have a commercial break in just a bit, but let me tell you about her. Her name is Dr. Alice Domar, And she is a pioneer in the field of mind-body medicine. She conducts ongoing groundbreaking research. And she's written this great book. She's written a lot of books, but the book we're going to talk about today is called Finding Calm for the Expectant Mom, Tools for Reducing Stress, Anxiety, and Mood Swings During Your Pregnancy. And boy, that can happen a lot. You know what? So many changes in your body. So we are going to talk to Dr. Domar after the break about finding your calm when you're pregnant. She has done so many things. She's the director of the Domar Centers for Mind-Body Health and the director of Mind-Body Services at Boston IVF. She's an associate professor at Harvard Medical School. She's the author, as I said, of numerous books on the advisory board for Parents Magazine, Resolve, and Easy Eats. She's been a columnist for Redbook and Health magazines. Getting out of breath. 3 of her books have been finalists for a Better Life Award. And she's been on TV, Today Show, Good Morning America, CBS. Maybe you've seen her. She's just wonderful. She presents lectures and workshops throughout the U.S. and around the world and went on tour with Oprah in the spring of 2004 and 2005. And she was also named to the prestigious list of 15 women to watch in 2004 and co-authored a book with one of my favorite authors, Susan Love. The book was called Live a Little, and she's working on her other book called The Stress Bump, which is going to come out. I don't think it's come out yet. We'll have to ask her. I can't wait to see that one because this book is great. And she also is a former publishing professional. And, that's Sheila Curry Oaks that wrote on her book. And she also lives in Boston with her husband and 2 children. So when we come back from the break, we're going to talk to Dr. Alice, and I can't wait because I have her book right here in front of me, and I have so many pieces of paper in it with questions and things that I marked because it's a wonderful book. If you're pregnant, if you're thinking of getting pregnant, or you need a great gift for somebody, this book's terrific. It answers all the questions. And I know when I was pregnant, I was nervous the first time. I kept telling my OB I was going to move my bed into his office because I called him so many times. You know, it's all different feelings. Your body changes. Sometimes you feel crappy. Sometimes you feel great. And Dr. Domar is going to talk all about everything. And if you have questions, you can call us at 877-864-4869. We'll be right back.
We'll be right back with more Help My Baby Came Without Instructions. It's Baby and Toddler Instructions with Blythe Lipman on TogiNet. We'll be right back right after these.
It's words you never heard.
Have you noticed that no matter how carefully you put the Christmas lights away, they still come out all kringle-crangled and jitterty the next year? Christmas tree lights were invented in 1882 by Thomas Edison, and by 1900, these miniature versions of his electric light bulb were being advertised to the public. In 1895, Grover Cleveland proudly sponsored the first electrically lit Christmas tree in the White House, featuring more than 100 multicolored lights. By the next Christmas, members of high society were hosting flambustious Christmas tree parties. Of course, in those early days, the services of a wireman had to be obtained, as many people had considered electricity as a bit of a bugaboo.
It's words you never heard.
I'm Carolyn Davidson, and you can have fun challenging your words you never heard vocabulary with my free app, Too Funny for Words.
It's the Fitness Minute with fitness expert Annette Hammond.
Nuts are an overall good choice for snacking. Almonds are my favorite nut, and I try to include them in my daily eating. Almonds have more calcium than any other nut. They are low in carbs, but high in fiber and protein. Studies show that eating almonds and other nuts will give you a feeling of fullness longer and help you eat fewer calories throughout the day. 12 almonds are under 100 calories and very satisfying. Peanuts are another good choice. Health Magazine says that like most other nuts, peanuts are also full of brain-boosting healthy fats and vitamin E as well. 1 ounce of peanuts, about 28 unshelled nuts, contains about 170 calories, 7 grams of protein, and 14 grams of fat. Eating nuts helps your brain power and reduces inflammation. For the Fitness Minute, I'm Annette Hammond. Like us on Facebook.
Welcome back to Baby and Toddler Instructions with Blythe Lipman on TogiNet. The hour for all moms with little ones to come for great advice, encouragement, and great ideas for all new parents. Now, back to the show with Blythe Lipman.
Well, welcome back to Baby and Toddler Instructions. I am so excited to welcome Dr. Domar to my show. Welcome. Thank you for being here. I know we were talking during the break, and her voice is a little off because she had a big speaking engagement yesterday, but you know what? We'll just have to deal with it. You have your hot chocolate. I have my tea, so we'll be fine.
People could also say I sound really sexy, but honestly, I don't sound this way normally, so I apologize.
Oh, you sound fine. It's fine. Also, I wanted to make a correction. I was talking to her, and her newest book, Finding the Calm for the Expectant Mom, Tools for Reducing Stress, Anxiety, and Mood Swings During Your Pregnancy. That is her newest book. She said that they changed the title. The Stress Bump was going to be the title, but it's not. This is the other title. So this is the newest and so good.
Oh, thank you. My editor felt like the Stress Bump was too negative, so we changed it to Finding Calm for the Expectant Mom. And, in fact, my niece came up with the title.
Well, it's a great title, whatever, and what's in it is so important. You know, what really hit me, I remember at the beginning of the book, you talk about you're pregnant, and it's great, and you're excited and bright, and everything's wonderful, and then you throw up.
Yeah. You know, it's interesting because actually when I gave a talk yesterday to, it was a conference of obstetric gynecologist professors, people who teach, who don't just, practice as physicians, but they also teach medical students and residents. And they were talking about pregnancy. And, they were saying how there's so many times where people come in being ambivalent. And I said the interesting thing for me is my office is physically based in an infertility center. And so I started out only seeing infertility patients. And then, luckily a lot of them get pregnant. And so then they tell their pregnant, non-infertile friends about me. And so about half my practice is pregnancy. But there's a fair number of patients that I see who went through infertility to get pregnant. And when you go through infertility, getting pregnant is like the holy grail. Like, all you want is to be pregnant with a healthy baby.
Yeah.
And yet so many of my patients, the ones who struggled to get pregnant, found out when they got pregnant that it wasn't a perfect experience. And that's actually what got me to write the book, because, if people who plan to get pregnant or who got pregnant by accident or get pregnant easily, they sort of anticipate that it may not be the easiest experience, and it's totally normal and healthy for them to come and call in and complain and things like that. But the women who went through infertility would come in and they said, I'm the only person they can tell how hard this is. And they feel really guilty complaining. And it made me think, if those women are struggling so much with pregnancy, a lot of women must be struggling a lot with pregnancy.
And you need a support group, because I know my daughter had a really tough time with her, being pregnant. She was on IV for the whole time. She couldn't stop throwing up. And it's tough when you can't say that to anybody because you're pregnant, and it's just, you're going to pop this baby out like nothing. That's a whole other subject about having the baby. But, it's great that you're there and people can tell you. But why, is it this myth? Because, women gave birth for years and they went, you see pictures, they went in the field and they stooped down, here's the baby.
Certainly, I think women feel very guilty complaining about being pregnant. I think for a lot of reasons. One is, you're right, a few hundred years ago, or even in lots of countries today, women don't have the luxury of pausing when they get pregnant. They just do what they're doing. But I think, for the last 50 years, there's been a tremendous amount of media pressure to perceive, and now social media pressure, to perceive that pregnancy is the perfect experience. And, women who are pregnant, if you actually Google pregnancy, let me rephrase that. If you ask people on the street, what do which I did for the book, what is the first thought you think of when you think of pregnancy? Radiance, glowing, Madonna-like, motherly, the best experience of a woman's life, femininity. Those are all the words that people think of when they think of pregnancy. But if you actually Google pregnancy, the words that come up with are vomiting, hemorrhoids, fatigue, pain, exhaustion. So I think there's this social expectation that being pregnant is this extremely serene, wonderful experience, that women love being pregnant, that it's, and I don't want to diss pregnancy because, I have 2 children. There were lots of parts of being pregnant that I loved, the fact that I have my kids, but I found pregnancy to be really hard. I didn't think I'd be throwing up for 3 months. That's not an easy thing to cope with. And what your daughter went through, which is an extreme case, it's not pleasant. And so in these days with social media, I have patients come in every day who've been throwing up all weekend, and they'll drag themselves in here, and they'll be either green or white depending on the moment. And they'll say, they look at their friends' Facebook pages of their pregnancies, and all they show is the perfect bump and the beautiful stroller or the baby shower pictures. And so my patients feel that they're doing something wrong, that they're not appreciating their pregnancy. And, I basically say, well, your friends may be showing the perfect bump. What they're not showing is their vaginal hemorrhoids. There are lots of things that people have during pregnancy that they don't share because you don't share stuff like that.
No, and I wonder, maybe nobody would be their friend on Facebook if they said the negative things, some of the things that do happen. Here's a question, though, that I did receive because I was talking to a lot of people about your book and being on the show. When you're pregnant and nauseous and you throw up, does it hurt the baby?
No, it does not.
And why are you throwing up? Is it hormonal?
There are a lot of theories about why people throw up when you are pregnant. Yes, it's clearly hormonal because, the vomiting and nausea and vomiting tend to be at their max the first trimester. But it also seems to be genetic. I had a patient here last week who was 10 weeks pregnant, and she was absolutely hysterically anxious because she wasn't nauseous. And she was sure that meant there was something wrong with the pregnancy. And I said, was your mother nauseous when she was pregnant with you? No. Was your sister nauseous when she was pregnant? No. I'm like, then you are genetically gifted. You're very lucky that, clearly women in your family don't get nauseous. My mother, when she was pregnant with me, threw up every day for 9 months. So I was doomed. And I have not told my daughters that, so I hope they aren't listening. But, it's not going to, we really don't know. Clearly there are reasons why pregnant women have aversions to certain foods and smells. So, in the first trimester, for a lot of pregnant women, the smell of coffee is gross. The smell of fish or meat is really gross. And it probably was because our ancestors, hundreds and thousands of years ago, meat and fish would spoil very quickly. And so if a pregnant woman would eat spoiled meat or fish, that could, in fact, hurt the baby. And so I think we have now, from an evolutionary perspective, developed aversions to foods which have the potential to harm our babies.
Interesting. Chicken did it for me. Don't make chicken in my house. I can remember going, that was awful. I'm going to be sick if I have to smell chicken.
Yep. Meats in general, the smell of roasting meat or fish is. I had a patient once who found that the only thing she could tolerate was sliced turkey sandwiches, literally just turkey on dry bread. And that was the only thing she could eat. And so she decided it'd be cheaper for her, as opposed to going and buying sliced turkey, be cheaper for her to roast a turkey. She couldn't be in her house for 2 days.
Oh, my goodness.
The smell of turkey made her sick. So she could eat cold sliced turkey. She couldn't
cook it.
No, could not smell the hot cooking turkey. So, what I tell my patients in the first trimester is to identify things that you are averse to, like the smells that you can't stand, the taste that you can't, and really avoid those. And, if you ate a bite of, fresh steak, is that going to hurt the baby? No. But if you have an aversion to that smell, don't push yourself as long as you're eating pretty good food. But what people, so everyone talks about, avoiding foods you're averse to, but let's look at it the other way. I ask my patients, what are foods that appeal to you? And I had a patient recently where, for whatever reason, like just plain lettuce, just plain crisp lettuce, really appealed to her. When I was pregnant, I'm a chocoholic. That's like, life is not worth living without chocolate. I couldn't handle
I agree.
buy chocolate.
I agree.
But I was very attracted to lemon. And so anything lemony, even like, lemony sodas or lemon tarts, I would get a piece of lemon meringue pie and only eat the lemon section. So as opposed to just focusing on the stuff that makes you feel gross, instead visualize what appeals to you. And as I said, citrus tends to appeal, minty tends to appeal. Some people find ginger very soothing on the stomach. So just look at it in a different way. Not what you can't have, but think about what you want to have.
And you should, you know what? And it's okay to eat a lot of it if that's what you want to do. That's what I found.
Right.
What I like, I could eat. I mean, everybody says crackers, put crackers next to your bed. That helped a little bit. And it's okay. People worry about their weight too. And it depends. You can't go nuts, but I've talked to so many people that say, oh, I'm so fat and I can't gain weight. Well, you know what? It's true. You're eating for two.
Right. Well, it's a myth, though. I mean, the caloric needs of a fetus is pretty small. And so, I had a patient 5 or 6 years ago who literally had a craving for mashed potatoes and ate a big bowl of mashed potatoes every day. And she gained 60 pounds. And her obstetrician was frantic. And so, you can't say I'm eating for two because, when you're 3 or 4 months pregnant, think how big the baby is and think how little nutrition that baby needs. But I think women worry too much about what they're eating, in effect because nutritional needs of this fetus are so small. And you want to try to eat decent foods. My older daughter, I think for about 3 months, the only thing I would eat is chocolate chip muffins. And she's now 5'8" and a soccer player. So clearly,
I'm so happy you're clarifying this because, while we do say you're eating for two, I'm happy you're clarifying it because some people will say, I don't want to eat because I don't want to get fat. But we're going to break for commercial, and when we come back, we are going to talk some more about being pregnant and how to stay calm. I mean, I'm open to this chapter. Dr. Domar has a stress test in here. How stressed are you being pregnant? That's wonderful. And you rate it, and it has all these great questions. So we will talk about that a little when we come back and so many other things. So please stay with us. We will be right back.
We'll be right back with more help. For help, my baby came without instructions. It's Baby and Toddler Instructions with Blythe Lipman on TogiNet. We'll be right back right after these.
Welcome to Geraldine Tegelove Live, the show that shares with you the secrets of redefining, reinventing, and rebuilding your life. Having pulled herself from the rubble of financial ruin and having gone on to create a highly successful career, Geraldine has become an expert in the art of transformation. She believes that it doesn't matter where you are right now, how overwhelmed you feel, or how impossible the task of turning your life around may seem. You can do it. Stay tuned as metaphysician, international best-selling author, and intuitive Geraldine Tegelove gives you the inner understanding and the outer practical how-to to create your amazing life. Gain a fresh perspective on how to redefine, reinvent, and rebuild your life. Join Geraldine Tegelove live every Tuesday evening at 6 p.m. Eastern Standard Time, right here on the TogiNet Radio Network. This is the TogiNet Radio Network, radio with a cutting edge.
It's words you never heard.
Did you realize that Twitter is over 10 years old? Twitter was first launched in March of 2006, with the hashtag feature appearing about a year and a half later. Twitter employs more than 2,700 people around the world. Today, there are over 241 million active users on Twitter, with an average of 500 million tweets per day. Now that's a lot of traffic. A lot of new words have been coined from the Twitter app. A tweetart is your Twitter boyfriend or girlfriend, and Twitterphoria is the feeling you get when they tweet you back. If you don't want to feel like a twittiot when you tweet, there's a whole list of proper twetiquette available. At first, even I was a bit of a Twitterphobe, but if you want to follow me at Too Funny Carolyn, that would be twit-tastic.
It's words you never heard.
I'm Carolyn Davidson, and you can have fun challenging your words you never heard vocabulary with my free app, Too Funny for Words.
Welcome back to Baby and Toddler Instructions with Blythe Lipman on TogiNet, the hour for all moms with little ones to come for great advice, encouragement, and great ideas for all new parents. Now, back to the show with Blythe Lipman.
Well, welcome back to Baby and Toddler Instructions. I am here with my wonderful guest, Dr. Alice Domar. She wrote a terrific book called Finding Calm for the Expectant Mom, Tools for Reducing Stress, Anxiety, and Mood Swings During Pregnancy. And boy, some of us have them, and it's okay to admit you don't feel great. You don't have to walk around in brilliance every day for those 9 months. You know, sometimes we don't feel great. Anyway, before the break, I have her book in front of me. It's terrific, and I love this because you put a test in here. How stressed are you about being pregnant? And all these questions: how's your energy level? How's your anxiety? You know, how much do you worry? And then you rated what it means, which is great to see, because I just wonder, have you ever asked your pregnant moms to be where they rated on the stress schedule?
Well, every chapter in the book has a quiz, because I really like quizzes. I mean, personally, like when I read a magazine, that's one of the first things I do is I take the quiz.
It's fun.
And it is fun. So we added quizzes, I think, to almost every chapter. And to help pregnant women, I mean, one way to do it is to take each quiz, and then whatever one you highest score is, that's the chapter you should read first. But it gives you a sense of sort of how are you doing? In this area, how are you doing in terms of your body? How are you doing in terms of dealing with your partner in the pregnancy? How are you doing in terms of your job? How stressed are you? How anxious are you about having this baby? And it gives you a sense, like, yeah, you know what? I've really got this. Like, I'm handling this pretty well. Or, middle of the road, I could probably use some help. Or, red alert, you need to shore up the resources in your life so that you can be healthier and happier during this pregnancy. And then we give suggestions. I mean, the book is, I don't know if you could figure this out for me. I'm not one of these theoretical people. I am very hands-on. Here's a situation. Here's what you can do to feel better. Your mother-in-law is giving you total grief about what to name the baby. This is what you can do.
I love the hands-on, because, you know what, it's real, and it helps you. And also, it gives you something to fix the problem right away, instead of reading all these studies and this person said this. Not that there's anything wrong with it. It's good to back things up, but I love if somebody comes to you and say, what should I do? You can say, here are 5 things that might work for you. But I have to say something. My biggest bookmark in here, I was blown away by this fact, because, we were talking about eating and weight before the commercial break, that a little-known fact is that the celebrities use gestational surrogates and they wear pregnancy pillows. Seriously? Oh, my goodness. Seriously. Why would you do that?
Well, I knew about it a long time ago, because I had a patient that I was seeing who was from a culture that did not allow surrogacy. And so, she and I talked at length, because she really wanted to have a baby. She had a disease where she couldn't carry a pregnancy, so she had to use a surrogate. So I remember sitting in my office, and the two of us looking at pregnancy pillows, and there were a lot of them on the Internet. And she actually, I don't believe she even told her parents that she wasn't pregnant. I'm pretty sure that only she and her husband knew. I mean, it would cause a little bit of stress, obviously, when neighbors drop by. She had to run and put on her pillow. And then I have a relative who lives in a country where surrogacy is not legal. And so she had to wear a pregnancy pillow as well. So, there are reasons for it that are cultural. There are reasons for it that are religious, where people can't say. But honestly, A couple years ago, I trained psychologists from around the world, and one of the psychologists was from Southern California, and she told me. And so, and that, obviously everybody out there knows, but I didn't know. And and the reason I say it is because I'm so sick of People magazine every year having this issue, body after baby, showing these celebrities, 6 weeks after they have their baby in their skinny jeans. Well, it's pretty easy to do that when you were never pregnant in the first place.
Oh, there's no way. I mean, it's just, but doesn't make you sad because yes, we're talking about being nauseous and we're talking about things that, okay, they're uncomfortable, but boy, having a baby and feeling them kick and, the whole experience, to miss that, to me, that's my opinion. I think it's sad. How about you?
Mm-hmm. Again, I work in an infertility center, and so we only do surrogacy for medical reasons.
Right.
If someone has the disease, if somebody has no uterus, if somebody is on medication where it would be dangerous to babies. So, and, the thing is, I've spent literally a year counseling women and couples who have been told by their physician that they have to do surrogacy, that their body, they cannot be pregnant, and looking at the psychological hit of being told you can't carry your own baby.
Oh.
So can I personally fathom somebody wanting to do that either for convenience or for, to avoid feeling uncomfortable or to avoid gaining weight or to be able to, keep a role? I mean, I'm not going to judge. I mean, and I'm sure there are some celebrities who also had medical reasons. I mean, you can't say that every single one of them. I mean, there are celebrities who've had their uteruses removed, and there are celebrities who are on medication, which is incompatible with pregnancy, and there are celebrities who have MS and lupus and other diseases where it's not safe to be pregnant. But no, I'm told that there are a fair number of elective surrogacy arrangements.
Well,
I think it's a shame.
Sad.
I don't know about you, because one thing I tell my patients all the time is that one of the things I loved about being pregnant was getting to know my daughters in utero, and just feeling that that they're with me all the time, and that when I would eat a certain food, they would kick more, or when they would hear my husband's voice, they would move more, and I felt like I had a sense of who they were before they were pregnant, and I wouldn't have missed that for the world unless I had to. And yet
exactly.
I've had patients and friends and my cousin who had to do this for medical reasons, and it broke their hearts.
Oh, I am sure. I mean, we we shouldn't judge, but then again, you know what? That was just my opinion. It made me sad. So let's talk a little bit about sleep. Sleep is tough when you're pregnant. What do you suggest?
Sleep is brutal. Well, it's interesting because, I think in my world where we counsel people with pregnancy, there's always sort of this talk, well, yeah, during the first trimester you have to pee a lot, and yeah, during the third trimester you're sort of uncomfortable. But it wasn't until about 2 years ago, a colleague of mine, Jody Mendel, who is a psychologist in Philly, and most of her work is on solving children's sleep issues, baby sleep issues. I think she even has a book on solving baby sleep issues. But she actually did a study where they surveyed hundreds of pregnant women. She's published this study. You can find it. They surveyed hundreds of pregnant women at all stages of pregnancy. And what they found was that very few of them were sleeping well. So it's not just having to get up to pee or having heartburn when you're near your due date. It's that women during pregnancy don't sleep well. And that's alarming for a lot of reasons. When you are sleep deprived, it's very hard to function the next day. It can lead to feelings of anxiety and depression. You're feeling overwhelmed. I mean, you're tired when you're pregnant anyway, but adding sleep deprivation on top of that. And then there's some data to show that women who are especially sleep deprived during pregnancy may be at a higher risk to develop postpartum depression. And so one of the reasons we focus so much on sleep in the book was giving women every tip we could think of or that we had researched to help women get a better night's sleep.
What's your number one tip to help them get a better night's sleep?
Well, there are lots of I'd say the number one tip is to figure out why you're not sleeping. So there's no number one tip. I'd say if you're getting up to pee every 2 hours, I'd say you need to look seriously at how much you're drinking after 7 or 8 at night, and see if you can really hydrate during the day, but not drink glass and glass and glass, of liquids in the evenings. If you have back pain and that's keeping you up, there are all sorts of pillow arrangements. There was actually a study that showed that getting a massage or a back rub from your partner decreases the risk of anxiety and depression, and it also helps you sleep because your back pain is relieved. So it really depends what's causing you to have sleep issues. You have to figure out the symptom that's keeping you awake and then figure out how to treat that symptom. So there's no overall tip.
No, and you were talking a little bit about how do you know whether you're just having a pregnancy emotion or you have depression?
That's a really good. Do you mean during pregnancy or postpartum?
During pregnancy.
Well, one, I think what sort of got me into this field was when I saw how many women while they're pregnant are taking antidepressant medication and how few of those women were ever evaluated by a mental health professional. So that's what sort of got me interested in this field. Pregnancy is very challenging. There's no question. It's hard to be pregnant, even if you're really happy. I mean, I remember I was ecstatic about being pregnant with my daughters, and yet I found pregnancy hard, and I teach this stuff for a living. But in fact, we realized early on that one of the most common ways to assess depression is called the Beck Depression Inventory. It's like a really quick, easy depression screening tool. But if you give that to a pregnant woman, she could be the happiest woman on the planet, and she's still going to score in the severe range because the symptoms of early pregnancy and the symptoms of depression are very similar.
Interesting.
So feeling tired, changes in libido, changes in appetite, not enjoying things the way you used to, feeling hopeless. So if you actually go through the 21 questions of the Beck Depression Inventory, I'm going to guess at least a third of them really can be about symptoms of pregnancy. And so you can't trust that these depression screening tools with pregnant women because you can have a very cheerful pregnant woman who just doesn't feel all that well. And so you really need to sit down with a woman and have an interview with her to talk to her and say, I stay away from what we call the vegetative signs of pregnancy, like, appetite, sleep, libido, and talk more about, do you look forward to doing things? Do you still feel connected to people? Are there things in your life that make you happy? Are you optimistic about the future? And if you can't answer yes to those, then I'd say, yeah, you do need to talk to your OB or your nurse practitioner, nurse midwife, but maybe whether you are depressed. Pregnancy is hard, and I think most pregnant women are embarrassed to mention some of the challenges or the ambivalence they're feeling.
You know what? And you shouldn't. That's great advice. We are going to break for a commercial, so I didn't want to interrupt you, but
that's okay.
That's great advice because, you know what, I remember in the beginning I was ecstatic, then I stopped sleeping, then I was nauseous, and then you start wondering. And I was serious about it. I was telling my OB I was going to move my bed into his office because I called him every day and asked him a question that he probably heard a million times, but I didn't know. You know what? No question is silly. So on that note, we are going to have a commercial. We will be right back with Dr. Alice Domar, author of Finding Calm for the Expectant Mom.
Welcome to Geraldine Tegelove Live, the show that shares with you the secrets of redefining, reinventing, and rebuilding your life. Having pulled herself from the rubble of financial ruin and having gone on to create a highly successful career, Geraldine has become an expert in the art of transformation. She believes that it doesn't matter where you are right now, how overwhelmed you feel, or how impossible the task of turning your life around may seem. You can do it. Stay tuned as metaphysician, international best-selling author, and intuitive Geraldine Tegelove gives you the inner understanding and the outer practical how-to to create your amazing life. Gain a fresh perspective on how to redefine, reinvent, and rebuild your life. Join Geraldine Tegelove live every Tuesday evening at 6 p.m. Eastern Standard Time, right here on the TogiNet Radio Network. This is the TogiNet Radio Network, radio with a cutting edge.
It's words you never heard.
Did you realize that Twitter is over 10 years old? Twitter was first launched in March of 2006, with the hashtag feature appearing about a year and a half later. Twitter employs more than 2,700 people around the world. Today, there are over 241 million active users on Twitter, with an average of 500 million tweets per day. Now that's a lot of traffic. A lot of new words have been coined from the Twitter app. Tweetheart is your Twitter boyfriend or girlfriend, and Twitterphoria is the feeling you get when they tweet you back. If you don't want to feel like a twittiot when you tweet, there's a whole list of proper twetiquette available. At first, even I was a bit of a Twitterphobe, but if you want to follow me at Too Funny Carolyn, that would be twit-tastic.
It's words you never heard.
I'm Carolyn Davidson, and you can have fun challenging your words you never heard vocabulary with my free app, Too Funny for Words.
Welcome back to Baby and Toddler Instructions with Blythe Lipman on TogiNet, the hour for all moms with little ones to come for great advice, encouragement, and great ideas for all new parents. Now, back to the show with Blythe Lipman. Welcome back to Baby and Toddler Instructions with Blythe Lipman on TogiNet, the hour for all moms with little ones to come for great advice, encouragement, and great ideas for all new parents. Now, back to the show with Blythe Lipman.
Well, welcome back. We are up to the last part of our show. It goes so quickly. I'm here with Dr. Alice Domar, the author of Finding Calm for the Expectant Mom, and she is the mother of 2 children. So I want to ask you, what's your favorite parenting tip? Also, after seeing all these pregnant women.
You know, it's interesting. I think my favorite parenting tip is to trust your children. Because my kids are now, they both just had birthdays. They just turned 16, and my older daughter turned 21 on Monday. And they're amazing kids. And people often ask me, you know, it's really hard to have a shrink for a parent. Like, it really is. But I think I've just always intuitively trusted my kids. And I always listen to their side of things. And I think that has helped a lot.
You know what? That is such great advice, because no matter how old they are, you know, once they hit 3.5, 4, they have opinions. And they'll tell you. Great advice. I love it. Great advice. Also, tell my listeners, where can they buy your book?
Hopefully everywhere. I mean, it's certainly available, you know, Amazon, Barnes & Nobles, bookstores. It's only been out for a few months. So it's out everywhere.
Also,
and
can
actually,
I say...
I even have a Facebook page, which I'm very... Well, I don't have a Facebook page. My 21-year-old daughter created a Facebook page, but I'm very excited. I feel like I'm very hip right now.
You are very hip. What is the Facebook page? What's the name of it?
Finding Calm for the Expectant Mom.
Okay, well, everybody needs to go there and follow that. Are you on Twitter, too?
No. That's beyond my technical capacity.
Okay. And it takes too long. Sometimes it takes too long. So let's talk, because we were speaking about depression before the break. Let's talk a little bit about being on medication while you're pregnant.
Okay. So this is like the question I get asked the most. And in fact, this is the reason really that I wrote the book, because I published a paper 2 or 3 years ago on the risks of taking antidepressant medication during pregnancy. And the reason I started looking into it was the question came up, you know, is it a good idea or a bad idea to take antidepressant medication when you're trying to get pregnant? And so then I was working with a high-risk OB, and we looked at all the literature on the risks and benefits of taking antidepressant medication during pregnancy. And I'd say my summary is, if you are somebody who have a long-standing history of depression and have really struggled with your quality of life and truly can only function in a normal way if you're on medication, then the benefits of taking medication during pregnancy clearly outweigh the risks. But I would ask that you consult with a psychiatrist who specializes, they're called perinatal psychiatrists, because they're the ones that know which medications are the safest to take during pregnancy. If, however, you sometimes struggle with life, most of the time you're okay, you've had some bad times, I truly believe that before any woman who is either thinking of getting pregnant or is already pregnant, before that woman goes on medication, she needs to really try other things first. For example, cognitive behavior therapy, which is a very easy, quick, fast kind of therapy, is just as effective in treating mild to moderate depression as are antidepressants. And it is safer to take, because the fact is there are some risks to taking these medications during pregnancy. They're not huge. Most women who take these medications and their babies do fine, but there are increased risks. And so if you can find other ways to treat your depressive symptoms without medication, that's always my first line of thinking.
What do you think about EMDR? Or Do you use
I think
EMDR?
EMDR is fine. I don't know if I've seen a lot of research in terms, and if you look at the data on depression during pregnancy, the intervention which has the most evidence is cognitive behavior therapy. And there have been, studies in pregnant women where they've compared medication versus CBT, and cognitive behavior therapy does better. Another form is exercise. I mean, simply taking a walk every day, getting some sun in your face, exercising a half hour a day. There have been some really nice studies on looking at exercise in pregnant women, and even exercising can treat depression as effectively as medication. Like
exercise.
I mentioned earlier,
Go ahead.
exercise is amazing.
For all of us, even if you're not pregnant, can you go back for a minute? Can you tell my listeners what cognitive behavior therapy is for those that don't know?
Sure. Cognitive behavior therapy, in fact, I was just explaining this yesterday to the OBGYNs I was speaking at. It's challenging automatic negative thought patterns. So, we are very negative about ourselves, and we tend to sort of ruminate or think about things over and over again. I'll never be able to do that. I'm not smart enough. I'm fat. Things are never going to go right for me. We have these negative thoughts that play over in our head. And cognitive behavior therapy gets you to get rid of sort of the illogical negative thinking and instead has you think what reality is. So, one of the OBs yesterday when we were talking about this shouted out his negative thought is that he was fat. And in fact, I'm looking at this guy, that would not have been one of the top 10 things that I would have said about him. And I said to him, well, what's the emotion beneath that? And he says, I'm a bad person because I'm overweight. I'm like, okay, that's where we're getting to. So in doing cognitive behavior therapy, he sort of ended up with, I may weigh more than I would like, but my real goal is to get healthier. Now, would you rather be thinking to yourself, I'm fat and I'm a bad person, or would you rather be thinking, I'd like to take some steps to get healthier?
So when somebody, is there a number one common issue that patients come to you with when they're depressed or even when they're not depressed?
It's never going to get better. When they're pregnant or when they're depressed, I'm never going to feel better, or things are all my fault. But I'd say those are the top two. Things are never going to get better. I am doomed to be feeling this way the rest of my life.
That's really, that's tough to deal with.
Yep. That's why it's hard sometimes to be a psychologist. But, the really great thing is when you do cognitive behavior therapy, if someone's going to get better, they get really better in 4 to 6 weeks. Like, I don't see people for 6 months. I see people for a couple months. And they get better. And then, even I do these, like in the book, we have cognitive behavior therapy exercises. And we have, someone can read the chapter on stress and actually they have examples there of automatic negative thoughts that pregnant women have. And so you can actually do cognitive behavior therapy yourself to challenge your own negative thought patterns.
And as you're saying that, I'm sitting here thinking, we all have those thoughts. Mm-hmm. Some days are not so hot and some days are great. And, just the fact that I wonder, does pregnancy make it worse?
Absolutely. It was funny because I was using this example during my talk yesterday. For pregnant women, I call it the midnight imp. For some reason, for pregnant women, when they wake up in the middle of the night, they have really scary, terrible, anxiety-provoking thoughts. And I remember when I was pregnant, I had it throughout both pregnancies. All my patients say that they really worry at night. And they wake up in the morning and go, that's ridiculous. Why was I so worried about that? And
that's
so we
really
also
good.
Yes, it's a very normal thing in pregnancy. So that's where we also have a lot of relaxation tips in the book, things that you can do in the middle of the night when you wake up and can't go back to sleep.
Just tell my listeners one or two.
One of them is called mini relaxations, where people just do focused breathing techniques, and it's a special kind of breathing technique based on diaphragmatic breathing, and literally within 10 or 15 seconds, your anxiety levels come down and you start to feel sleepy. You just literally do it while you're lying there. It's very effective.
And easy.
And so easy. Everything I teach is easy.
You know what? I love it. I love that you give direct answers, and it's just wonderful. I have to let you go in just a second. Again, tell my listeners where to find your book and where to find you and your website.
So the book is called Finding Calm for the Expectant Mom. My name is Alice Domar. I believe the Facebook page is also called Finding Calm for the Expectant Mom. And I have a website, dralicedomar.com.
Well, anybody that's pregnant, trying to get pregnant, or you want to give a great gift to somebody that is pregnant, I love your book. It's terrific, and I would love to have you back on the show. And I will look. She told me something during the break. Am I allowed to say about your app? Maybe there'll be an app coming soon?
I'm working on an app right now on finding calm during pregnancy. So
well,
real hands-on. It'll include relaxation, guided relaxation.
Well, I'm breathing calmly after that. Thank you so much for being on this show. You're a great guest. Go take care of that sore voice. Drink some more hot chocolate and put some marshmallows in it. Got to have the marshmallows.
Thanks so much, Blythe.
All right, take care.
Okay,
bye-bye. Boy, I sure wish Dr. Domar was around when I was pregnant because I was nervous. Anyway, next week, my guest will be pediatrician Dr. Jane Scott. She is going to share her expertise to help you care for your little one without losing your joy, your mind, or yourself. So I can't wait for that. You know, we'll go along talking about the babies. If you ever want to be a guest on my show, you can contact me via the TogiNet site, toginet.com, or again, go to my website, mybestparentingadvice.com. And please like my pages on Facebook. I have Baby Instructions, My Best Parenting Advice. On Twitter, I'm at Advice Parent. And again, of course, my website. You know what? I am going to put some new articles on the website coming up, and I am going to start doing videos, live videos on Facebook to share some of my tips because I have thousands of tips to help you if you're the parent of a newborn, if you have a toddler, again, anything up to age 4, as long as it's not medical, and I'm always there to help. And if you want to contact me, call me at my office, 480-510-1453. And don't forget to listen to all the other great shows on toginet.com. Also, take time every day to sit down and have fun with your little one. You know, I talk about January, and we're trying to get back into the swing of things, and everybody's nervous, and then your kids get sick. They're in preschool. They have a cold. Those minutes you can't take back. So take a few minutes and have fun. I'd like to leave you today with a little humor from a page called Mommy Has Potty Mouth on Facebook. It always makes me laugh looking at this page. A banana is 105 calories. A glass of Prosecco is 80. Choose wisely. If you take a bit of cake, cut it in half, then it's only half the calories. And because it's only half the calories, you can have twice as much. Boy, I love her math. And finally, for all you moms out there or moms-to-be, how long a minute is depends on which side of the bathroom door you're on. Boy, isn't that the truth. Mom, I can remember my kids knocking at the door. Have a great rest of the week. See you next time. Bye-bye.